Howdy, I'm Eric Steiner, and I did my presentation on the movie One Flew Over the Cuckoo's Nest. The character I chose was Mildred Ratched, or more commonly known as Nurse Ratched. She is a fictional character in the 1975 film adaptation One Flew Over the Cuckoo's Nest. Nurse Ratched worked at a mental institution in Oregon, which there she strictly went over the day-to-day operations of that institution, often at the expense of her own patients. I have diagnosed Nurse Ratched with obsessive-compulsive personality disorder, which is a cluster C personality disorder on the DSM-5 category scale. Some common symptoms that are associated with obsessive-compulsive personality disorder are being highly preoccupied with rules and regulations and becoming inflexible in changing those rules and regulations or routines and schedules. Secondly, people that display obsessive-compulsive personality disorder are going to be highly devoted to their workplace, and will often neglect social relationships because of how devoted they are and preoccupied with their work. Finally, people that display obsessive-compulsive personality disorder are going to have a need to control order and cleanliness. The first symptom that Nurse Ratched displays well is her neglect of social relationships. And throughout the film, Nurse Ratched is very cold and unfriendly with her coworkers and especially her patients. However, the best representation of her neglecting social relationships is when, in the infamous cigarette scene, when she refuses to give Mr. Cheswick, one of her patients, his cigarettes. But not only does she refuse to give him his cigarettes, she also punishes those who speak up against the order that Nurse Ratched gave that he should not have his cigarettes. The second symptom Nurse Ratched displays well is inflexible in routines. Nurse Ratched is frequently pushing schedules and routines. The best example of her excess need of routines is when she demands that the mental institution return to its daily routine directly after one of her patients, Billy, committed suicide. Additionally, Billy committed suicide due to the fear that Nurse Ratched would tell his mother that he had sex the previous day. The one symptom that Nurse Ratched does not display well is cleanliness. However she maintains a clean nurse's station, she does not display symptoms of excessive cleanliness throughout the ward, meaning that she does not overly care how disheveled the patients look, nor does she care when the patients leave about chairs in the actual ward. Possible treatment. The best treatment option for Nurse Ratched is psychopharmacological followed by behavioral therapy. It was said that medication followed by therapy is most effective, and the goal for Nurse Ratched would to make her more empathetic towards her patients. And cognitive behavioral therapy was chosen because it best targets unwanted behaviors, and the only ethical problem this would arise would be it would change her personality, and it would possibly make it so she could not continue her work anymore. Portrayal in film. Nurse Ratched portrays obsessive-compulsive personality disorder in One Flew Over the Cuckoo's Nest fairly well, as she is in constant need of control, even to the point at which one of her long-term patients commits suicide. Often in other movies, psychological disorders are highly exaggerated, and they often show all of the symptoms. So in real life, this makes us think that people that have these specific psychological disorders are going to be highly showing all of their symptoms. And here's my works cited for the film and the pictures that are included.